Dear students, today our lecture is dedicated for post-vaccination complications. So let us discuss common causes of complications. Common causes of complications from vaccine, yes. Failure to comply with contraindications. Pediatricians or parents doesn't know about some contraindications for vaccination. Second, violation of the rules and techniques of vaccination. It is cold chain, yes, saving vaccination or expiry date of vaccination, and etc. Color and temperature of saving vaccination. Next, poor vaccine quality. Quality of vaccine will be poor from factory. Next, violation of common conditions of transportation and storage of vaccine. Next, individual reactions due to vaccine. In spite of everything, most cases we have individual reactions of each body. A baby have some contraindications or some reactions. Yes, we have complications after vaccination, and we have reactions. Complications will be divided into reactions and into systemic condition. Reactions, it will be it is individual and it's not serious, but complications as a systemic, it's serious and dangerous and must be treated. Complications, most complications on BCG, for example, are caused by improper insertion technique. In the fact for that proper vaccination it's necessary to comply with a lot of conditions. Separate rooms, special syringes for intermediate injection, or relatively complex vaccination technique, especially in newborn babies. World Health Organization distinguish 4 categories of complications. Local will be, general will be, and generalized lesion with a fatal outcome, and allergic with BCG syndrome. Local, it is subcutaneous cold abscess. Local complication occurs when the vaccine is incorrectly administered, develops after 1.5 months, requires surgical treatment. Next, ulcers larger than 10 millimeters. A consequence of a higher individual reactivity of body, this complication differs from the normal reaction in a size and intensity, requires a local treatment. Next, inflammation of the regional lymph nodes. While BCG vaccination, bacteria will penetrate beyond the skin into the nearest lymph node, considered as a complication of the node increase to 10 millimeters. Next, keloid scar. With a scar size of less than 10 millimeters, no treatment is required. Surgical treatment is contraindicated. Further BCG vaccination is also contraindicated. Local complications. Since the vaccine is administered by mouth, local complications should be considered. What happens in the intestines? Intestinal dysfunction is a rare complication of oral polio vaccine and doesn't require treatment and resolves its own within a few days. It's not a contraindication for further OPV vaccination. General complications, allergic reactions divided into within 4 days, detected after vaccination. The association with the vaccination is also controversial. If the child has been tested for food allergies, it's also not a contraindication for further vaccination. The exception is the causes of allergy in the antibiotic kanamycin, which is contraindicated in domestic vaccines. So, Let's discuss one by one. While measles, yes, which reactions may be? Allergic reactions, convulsions due to fever, present central nervous system disorders, encephalitis, for example, against the background of the vaccine reaction, inflammation of the lungs can be developed and temporarily decrease in the number of platelets in their blood being. Complications of rubella. The vaccine is absolutely contraindicated for use during pregnancy, regardless of its duration. However, it is still happened. It's not recommended to terminate the pregnancy. A rare complication is a temporarily decreased in a number of platelets in the blood. The same is with the measles vaccination. It occurs 2-3 weeks after vaccination. Allergic reactions can be caused by a presence of trans amount of antibiotics, kanamycin, neomycin, in the vaccine. Mumps. About complication of mumps, we may say the characteristic of mumps vaccine should be called short-term swelling of the testicles in boys passing without consequences, serious meningoencephalitis, 1 in 30-100 cases, which appears on days 5 and 30 days and passes after a few days without any consequences. Complications of HIV vaccine, hemolytic infection. There are no specific complications. HIV vaccination, however, those are possible in people who are allergic to tetanus toxin. So for today is all we have discussed about vaccination during working time, during working in especially who works in rural places, who works in a city hospital, pay attention for vaccination history of every baby. It's very important. It's very important for treating current disease. Thank you for attention. Be healthy.